Somebody's asking, what about, can we use microneedling at home? Any side effects? I would say that is not going to have the same effect.
No.
But I will
Yeah,
ask.
true. What, like you said, that's not going to have the same effect because the ones that you use at home should not be more than a 0.5 mm needle size, which hardly will just about scrape the outer dead layer of your skin. So if you want to actually touch the collagen, it has to be somewhere around a 2.5 mm depth of needle. So you're not going to use that on your own. Two, if you ever try to use it on your own, please make sure it's disposable and throw off after each use and do not reuse it. Three, there's always chances of infection. So I would say leave it to the expert's hand and don't try these things at home.
Yeah, thank you. I'm really glad to hear you say that. I have a lot of incoming information from the skincare companies which use microneedling and or practitioners who use them as part of a facial maybe, and these are tiny.
Oh no.
And they will say, they will always imply there's a collagen stimulation going on there, and you think there can't be.
How
exactly. Yeah. Okay, right.
Yeah.
I get told this so often I start to doubt myself, you know, and then I
yeah.
By the experts. Thank you. Somebody's saying, would you recommend micropigmentation for thin eyebrows? I mean, that's can be very good, can't it? If it's...
Why not? Yeah, if you have your doctor's clinic who definitely will have an esthetician who does micropigmenting onto the brows, why not? But make sure you go to a qualified center, a hygienic center, because at the end of the day, it's needles with the pigment that's going into you. So you need to be really, really careful. But yes, good idea.
Thank you. And in the UK, I notice all the eyebrow, what do you call it?
Microblading.
Microblading. They've all started doing a really fine feathering technique, which looks so much better even than what they were doing 2 years ago.
Yes.
So I think look at what they do on Instagram. I'd say to whoever asked that, because you can start to see which ones do the more subtle work.
And tell me also.
Yeah, I'll send you. Send you some. There's who here, Karen Betts does amazing work. It's so subtle, and you don't realize looking down her Instagram till you see some of the male eyebrows she's done, and you think, well, that looks quite nice. It's a sort of very natural looking, and then when you swipe to the before, you see that this was a cancer patient who had no eyebrow, and she's created something that looks like it just grew in that. Yeah, I mean, really, I'll send you a link. Somebody's asking, can lip darkening happen due to dark lipstick? Surely not.
No, not really when you use dark lipstick. But if you do use lipstick, probably from a company which is not good enough, or an old lipstick, or a lipstick which is not hygienically maintained, or you have an allergy to pigments, then that can darken your lips. But not dark lipstick is not going to darken your lip. No, that's not going to happen.
The cosmetic, you wipe it off.
Yeah.
If a thank you. Are you okay to take these questions as we go along? Because you're getting a lot. I know.
I'm happy to do that.
On social media. If a client gets eyebrows after Botox injections, how can you sort it out? I think more Botox, that's the answer, isn't it?
Yeah. So if you do get an arched brow after that, which means some of the muscles here have been left over, but then there's been extra Botox given to the center. So this is holding, and this is what ends up happening. So you would end up giving a few more units here to just about lower this. That's how I would address it. And also sometimes there's a muscle here called as depressor supercilii. When this becomes too heavy, I end up knocking that muscle. It's a very expert injection of a deep injection here, and that just gives you a pop lift. So that really helps. So yes, it kind of takes, we could repair it, definitely fix it.
Okay, fab. But it takes an expert. It takes a real expert to do that. Yeah.
Yes.
It's you know, you've got to know such detail of the anatomy and then apply it to the individual. That's something that I think doesn't get emphasized often, because people will certainly, you know, in the UK we have such terribly loose, well, no regulation around who can use fillers.
Surprising, that is. Yeah.
And then those people often start using toxins which they shouldn't be able to get a hold of, but anyway, they are not the people to go to. a couple of questions about collagen supplements popping in here. One, do they have any side effects, and should one take them in the 30s? I don't know your views on collagen supplements, the hydrolyzed collagen of the sort.
Yeah. So collagen supplements are good to take, but if you're thinking collagen supplement is going to lead to collagen in your face, that's not how it works. So collagen supplements that you take are usually concoction of really good amino acids. What they end up doing is help repair the collagen, help make your skin more hydrated. But some of those collagen drinks and powders, I don't really believe in them because they need a lot of sugar and additives to make it more palatable. Otherwise, it really stinks because usually it's marine source. So I believe more in the tablet format of it. So that's something is what you need to kind of try and look. And
okay.
no side effects if you go to a trusted company, maybe a dermatologist-backed company or a company which is, one of those standard cosmetic companies or the nutraceutical and dermatology companies. So that's what you need. Don't go by what's on the internet.